Welcome. My name is Dr. Jigar Patel. I am Vice President and Chief Medical Officer for Cerner Government Services. I have the pleasure of taking you through the Cerner EHRM solution placemat today. First of all, we're going to cover some basic tenets around the Vista to Millennium migration from an implementation perspective. Obviously, you have Vista, CPRS, plus many other systems that you use today. What we're going to do in this deployment process is streamline and unify many of those things into the Cerner platforms, which I'll talk about in a second. One of the biggest efforts that's involved in doing this is a standardization of how the VA practices across the nation. By using a single unified platform, which I'll talk further about, we'll actually be able to move many disparate and different unique processes to a more common standardized one. Having said that, standardization does not mean every VISN will be completely the same. There will be localization efforts to make sure that your VISN representation has the ability to configure and localize the Cerner solutions to meet the needs at individual VISNs. One thing you will notice as I go through the solution placemat is there's a number of new, different solutions or systems that are outside of CPRS or Vista that you may have used in the past that are one-offs. So they had to go be acquired, commercial off-the-shelf software, or even some custom internal VA created software. So with that, I'm going to take you through the basics of the Cerner platforms. The three platforms we're going to be talking about today are Millennium, CareAware, and Healthy Intent. Millennium is the core of the EHR. It is the day-to-day that the vast majority of the VA end users will be using to take care and facilitate care to veterans every day. Millennium is a single database that will be scaled across the nation. So we intend for, whether you are in Seattle or Los Angeles, Maine, or Florida, or other places outside of the continental United States, you'll have the same view that everybody else in the nation would have as well. That also means for the veteran, you will have the same information no matter where they're being seen. As part of this roadshow, there will be some discussion around the technical implications of data migration and moving from the current environments you have in Vista to the Millennium and Healthy Intent platforms, and you can reference that recording to get more information about that. So many of the solutions I will discuss in the following couple pages of slides are Millennium, and that's the core of what we'll be doing from a transactions, orders, documentation for the care of veterans. CareAware is a platform that was created to solve the device connectivity problems that are associated with electronic health record implementations across the nation. CareAware is a platform that allows a plug and play of medical devices, if they are capable, into the EHR. That plug and play approach is managed by drivers. Much like in the old days when you had a camera and what was new to you, you went ahead and bought the camera, downloaded the driver, and then the computer was able to talk to that camera. With CareAware, we're trying to do the same thing for medical devices. Currently, the CareAware catalog has over 800 certified medical devices, and as part of our deployment process, we will go through your institutions and understand all the medical devices you use today. And when it's appropriate, we'll connect those devices using the CareAware platform. Finally, there's Healthy Intent. Healthy Intent at its core is a big data platform. So what does that mean? It's intended to help facilitate population health management, but a big component of population health management is data and analytics. So at its core is a analytics engine. What we also do with Healthy Intent is as we bring information in, that can come from a number of different sources. In the commercial sector, we've connected over 600 disparate types of systems. What we do is we normalize that data into common terminologies, map them so that the system and people using the system can understand them and cross-reference them if need be, and then build programs on top of that, one of which we'll talk about, specifically Healthy Care and Healthy Record, that allow care managers in the outpatient space to provide care virtually in a high-touch way, perhaps using the phone or monitoring devices from the veterans. So Healthy Intent will be a big piece from a data analytics in the future, as well as how do we care for patients and the care managers caring for those patients. Now I'm going to dive into the placemat itself. The EHR capabilities that we are bringing to bear were created in conjunction with the VA and the DoD. The Department of Defense, as many of you know, had acquired the Cerner solutions in a competitive bidding process. When we went to discuss with the VA what they wanted to do, we started with what the DoD had from a solution perspective. In analyzing what the needs were for the VA, we found there was a delta and there were additional Cerner solutions that could be brought to bear to help the VA care for veterans or facilitate the care of veterans. And we've broken it apart into areas that are relatively intuitive to understand who and how they will be used, and I'm going to go through that today. In the upper left-hand corner of this particular slide, you'll notice the first section called Access Management. You'll also notice there is a green box that actually says the word Demo. That means in the day in the life you may have viewed or will be viewing soon, that solution is actually shown in that video. Access management really is about registration and scheduling. The big takeaways here is, again, a single unified registration system in Millennium across the VA enterprise. That will be linked to things such as enrollment system and then be used by other downstream systems or upstream systems as a way to track patients. Scheduling is very, very important. The Cerner solution is a resource-based scheduling system. What does that mean? That means you can have a person, a place, a room, a thing, and a provider all scheduled at the same time. So no longer are the days where you have to try to coordinate schedules. The scheduling system, because it is resource-based, allows us to go ahead and pull all of those things together. The system itself checks all those calendars, can actually recommend dates and times, even based on veteran preference. Very important piece that'll be used in your ambulatory settings, be used in your ancillary settings where they do have scheduled appointments such as radiology or surgery, and can be used to manage, obviously, those clinic schedules very, very closely. Acute care delivery. Obviously, your VA medical centers are large institutions, and there are a lot of things that go into the care of a veteran at a VA medical center when they're on an inpatient stay, or an observation stay, or an ICU stay. We've highlighted a couple things in here that are important. It is, again, a single unified place for the care team to take care of the veteran. The vast majority of these providers will be using a tool called PowerChart. You see that elucidated here. PowerChart is the main application by which care is managed, coordinated, and facilitated using the electronic health record. A physician uses PowerChart, a nurse uses a PowerChart, your OT, PT, most of your front-end staff are going to use that, and the tools that I'm going to describe are embedded therein. So you don't actually have to go to multiple different applications to go ahead and take care or document the care of the veteran. Very important, obviously, VA and Vista were groundbreaking in many ways, and one of those aspects was computerized physician order entry or provider order entry. That's a fully integrated solution and will facilitate the ordering of every aspect of the care of a veteran. That goes from appointment follow-ups to DME, prosthetics, meds, labs, radiology, and then anything else that could be coordinated via a consult or a referral. So today in the current environment of VA and Vista, you have a lot of different tools that help to manage that, and some are integrated and some are less integrated into Vista. We'll unify most of those into the single orders conversation. Infection control, a fully integrated infection preventionist solution that is embedded in PowerChart. Med administration record is a big piece of that. It's actually not mentioned until we get to some device connectivity things. That includes your barcode med administration, or as many of you know it, BCMA. Again, a fully integrated solution. Don't have to log into a new system. The MAR from the EMR helps to drive that workflow and can be done with Bluetooth scanners if allowed by cybersecurity. Nursing care in general is all embedded in PowerChart, and a big piece. Most roles have a single place they start. From a nursing care perspective on the inpatient side, that is a tool called Care Compass. Care Compass is an organizer that helps a nurse and the staff in the acute care spaces manage the patient's new orders, documentation, provider communication information, and activities that need to be performed for the veteran. That could include documentation, reminders around when vitals need to be taken, medication administration, etc. In the ambulatory setting, again, a fully integrated solution. Physicians that work both in a venue of acute care and ambulatory will have a single login. When they go to their solution, depending on what venue they are working in, they will actually start in a different place. If you're in an acute care setting, you'll work from a physician work list. If you're in the ambulatory setting, though, you'll be working from your schedule. And again, that's fully integrated and the same schedule as that is reflected in the scheduler's workflow in the scheduling tool we talked about previously. So PowerChart Ambulatory uses many of the same components that are available in the acute care setting, such as problem list, how you order. We will restrict or refine the order catalog that is available to you in different settings. Some don't apply in the ambulatory and vice versa for the acute care. So you'll have a tailored experience, and we can configure that in Millennium. Patient accounting, patient scheduling and registration, also fully integrated. Again, many of the same tools you'll see on the acute care side and I've talked about previously, same here. Two important pieces that we'll be adding. Number one is ambulatory referral management. Many of you are familiar with your consult process, how you get providers to see a patient in an acute care process. We refer to those as referrals. So whether that's inside your VAMC, outside in CBOCS or other VA facilities, or even out into the community, we'll be able to manage that starting with an order, and that will go to a referral management queue and be able to facilitate the care and the choice of the veteran going into the community. Discern Encode is a computer-assisted coder that allows natural language processing to read through a note and provide a recommendation for an E&M code for that particular visit. So as the provider goes ahead and signs their note for the visit, they will get the aid of an encode to go ahead and recommend an E&M code appropriate for the documentation that was done. Next, we'll be going to behavioral health. Behavioral health solution, again, integrated. They will be using PowerChart. That PowerChart acute and ambulatory for behavioral health has content that's specific to and designed for the care of those patients with mental health and behavioral health needs. There is a number of security options inside of Cerner Millennium that allow us to restrict information if it is chosen to be appropriate to restrict that information. Those processes are happening during our implementation and during our deployment and will be further elucidated as we get through that process. Next, we're going to talk about device connectivity. Previously, I discussed CareAware and that platform and how we manage the connectivity of devices to the electronic health record. Now, one thing I can do here is clarify what I mean by devices. That includes everything from laboratory instruments to vital signs monitors, ventilators, bedside monitors, etc. So CareAware allows the facilitation of connection of all of those different disparate medical devices into EHR so that the EHR becomes a source of truth and actually facilitates workflow. By doing the connections of things such as vital sign monitors, we can reduce the burden of documentation on nurses, patient care technicians, and other folks that are working with those devices. PowerChart Cardiology has two major components. Number one is PowerChart ECG. PowerChart ECG allows for DICOM-compatible carts to get a wireless work list that actually can be uploaded wirelessly directly into Millennium. It also provides the cardiologist with a workflow to sign out those EKGs. PowerChart Cardiovascular actually also further enhances that and allows the documentation and workflow around Holter monitoring, cath lab, echocardiograms, and other cardiovascular testing modalities. All of that integrated into a single place to do all of their work, instantaneously available to everybody else who needs those reports inside of the VA medical centers and locations that you take care of veterans in. Case management has two pieces, and in this case, when I refer to case management, I refer to the acute case management, your social workers, and your other folks that are also doing things like UR and necessity checking, etc., while the veteran is in an inpatient stay. We've integrated Milliman into PowerChart, so the criteria for admission are also right in the workflow. Post-acute referrals is actually using a partner of Cerner's to facilitate the placement of veterans into community living centers and or skilled nursing facilities, assisted living facilities, and other levels of care, whether they be inside the VA proper or out in the community. We can electronically send a packet of information to a number of choices, veterans that veterans have said, I would like to have an assisted living facility near my home. Those facilities can then ascertain if they can meet the needs of the veteran and respond electronically as well. Gone are the days of folks who are coordinating discharge where they have to work in several different systems such as email as well as a chart as well as a standalone case management system. Cerner Math is a set of tools that are created using machine learning and predictive algorithms. We included a number of those in the DoD contract, and the VA has those as well. We will work over time with the VA to define what are the needs from a machine learning and predictive analytics to further refine the list that you see here. As many of you have seen and ascertained, tetralogy of flow is generally not applicable to the veteran population. So we will work with the VA to understand what are the needs, but at a minimum, things like readmission predictors for community-acquired pneumonia and COPD do have immediate applicability to make sure veterans are getting the best level of care as they transition from an acute care facility and try to keep them at home and comfortable there. Clinical and document imaging. Cerner Millennium allows for a complete workflow for scanning as well as viewing of those information of those scanned images. So we will be providing the VA with a vendor-neutral archive that allows scanned images as well as secondary usages of PACS images in Millennium as well. So with that, you'll have one of the most common use cases is single document scanning. That will be available at the front desk of many locations so that if a veteran does bring something in that needs to be scanned into the record for everyone's awareness, that can be done at the point of care. You'll also be able to do other things from an HIM perspective related to document imaging. Knowing that all of these things, the documents, whether they're scanned or natively created in Millennium or coming from a migration from Vista, will be available in a single place inside a PowerChart for people to view. Community and consumer health. Broad category, obviously, and VA is groundbreaking and leading the charge in many areas related to telehealth. We'll start with some of the basic pieces, and first and foremost, that's Healthy Life. Healthy Life is Cerner's patient portal and allows for direct communication from Millennium to the patient. As an example, when a patient receives discharge instructions from their acute care stay or their ambulatory visit, that'll be sent directly to the Healthy Life portal so the patient will have that not only in paper if they so choose, but also electronically. The Healthy Life portal does have some functions that are additive to My Healthy Vet, but also My Healthy Vet does have a number of things that are uniquely VA. We are working with the digital service as well as the folks in the patient engagement space to understand and make sure we have a complete repertoire of elements available to the veteran, including portions of My Healthy Vet and some of the new functions that may be available from Cerner in Healthy Life. One of those is the ability to do scheduling, that scheduling request, or even allowing the veteran to directly schedule. Again, that'll be a clinic by clinic and a VAMC by VAMC choice. As we allow them to do that, they'll be able to, in Millennium, the schedule will be able to look at those and verify, contact the veteran if they're using a request functionality to schedule their appointments. They also will get information from their records, such as notes, laboratory results, when their next appointment is, etc. As a part of Healthy Life, we have the ability to push to a veteran a clipboard. That clipboard is something that is an electronic form that allows them to fill out and update their medical information prior to coming in to the clinic or the venue of care they're going to be visiting. Those can be appointment specific and be pushed based on what the veteran is coming in for. As we build out those clipboards, that allows the veteran also to have a more robust experience in interacting with the providers in the VA medical centers. We can take away, if you're still using paper in some locations, we can try to take some of that away. That functionality is then in the physician, nurse, care team workflow. They're able to validate that information and check it with the veteran and include it in the record prior to the visit if they so choose. Inside of the patient portal, we'll also have the capability of doing native video visits. Now, we're working with the telehealth community in the VA to understand all of the aspects of telehealth. This particular native application allows for the ability to use smartphones to do web visits with VA providers. Finally, we have an engagement or wellness portion to the portal that'll also be integrated into the solution and be available to drive wellness in the veteran population. Overall, the telehealth capabilities of the VA are being analyzed to ensure that we don't lose any functionality and or work with current functionality to make sure it is integrated into the future rollout of EHRM. Next, we're going to talk about critical care. Critical care is a very important venue, obviously, very sick patients, and that use a lot of resources to help them get better. First and foremost, iNet Critical Care is integrated into PowerChart, uses many of the same tools you'll be using on medical surgical units and other places inside the VAMCs, and can actually cover any of the areas such as cardiac intensive care, medical intensive care, surgical intensive care, and others. So that tool is there to facilitate the documentation. And as the veteran moves from one venue of care and they move to a step down perhaps and then to medical surgical and eventually home, that's a single longitudinal record. All the data is in the same place. And based on the need from the provider that's taking care of the patient at that time, they'll see that information or can have access to that information very easily inside of their workflow. A couple extra tools that are provided are Apache. Cerner is the owner of Apache 4 and 5 scoring systems, and we have dashboards that do benchmarking across ICUs across the nation and across the world for that matter, but also allow the VA to have access to all 77 of the Apache scoring tools. Critical Care Dashboard, also known as iAware, is a heads-up display that is displayed at the veteran bedside in the intensive care units. And what it does is it basically puts together all the complicated information you would get on your ICU flow sheet in a heads-up view so you can see and correlate things such as medications, hemodynamics, laboratories, infusions, etc. As part of iAware, we actually have the tool that I refer to next called Infusion Management. Infusion Management is a suite of tools that allow for a physician or whoever's placing the order to order an IV medication. That IV medication then can be routed to pharmacy where they prepare it. When it comes back to the unit, it allows the nurse who's going to be administering that to go ahead and scan the patient, scan the bag, scan the pump. That pump is then automatically programmed with the order from the physician. And as the nurse validates that scanning and starts the pump, that information from the pump and the infusion is going directly back to the electronic medical record. The nurse has a workflow to validate that information and then include it in the record. When you're doing rapid titrations on a very sick patient, it has a huge time savings component. So we can actually mitigate and make easier that process of taking care of these complex patients with multiple drips that are being changed rapidly. Included in Infusion Management is a pharmacy dashboard that allows the pharmacists that are looking at the ICUs to know the status of those drips, again, based on the information from the pump. Dental. We work with Henry Schein as our dental partner to provide the Dentrix solution. We've done integration with Dentrix to allow for ordering and very easy movement between Cerner Millennium and the Dentrix solution. Emergency medicine. The tool that you'll become familiar with is FirstNet. FirstNet is a clone of PowerChart. It is essentially PowerChart. The chart looks very similar. The thing that's the major difference is where do you start? In the emergency department, you're going to start with what we call LaunchPoint. LaunchPoint is a modified, expanded, a more functional tracking board that actually facilitates the care of the veteran across the roles in the complex environment of the ED. That LaunchPoint can drive documentation from a physician perspective, orders, notifications, and all the coordination that needs to go into taking care of patients in the emergency department. So all the way from triage to tracking to documentation on the physician, nurse, and other care team members is all accomplished in one solution. Greatest thing about this is it's all Millennium. So as the patient is transitioning from the ED to the inpatient side, if they are getting admitted, it's a single record. None of that information is hidden in another system. In fact, your hospitalist or whoever's taking care of the patient, receiving the patient in the med-surg unit as an example, can look into the record as the patient is in the emergency department and see what's going on if that patient's going to get admitted to their unit. The flow of information, the integration, is a big driver for using a unified Millennium platform. Extended care. VA today uses Care Tracker in a number of locations, which is basically for documenting the activities of daily living inside your CLCs and other extended care facilities. In addition, you'll be getting PowerChart Long-Term Care, which allows for documentation specific to those skilled nursing or assisted living facilities, as I've mentioned, as well as inpatient and outpatient rehabilitation. We are doing a significant amount of work with the deployment team and the design team to understand all the unique areas of rehabilitation that exist in the VA today, such as blind vocation and rehab, polytrauma, TBI, etc. VA does a lot of great work in these areas that are unique, and we are augmenting the content inside of Cerner in our model content to meet the need for the VA. So we will be able to use that set of solutions in all of those venues to take care of veterans as well as service members that may be visiting a VA to be rehabilitated in a way that makes sense for their lifetime and their career. Next will be use Cerner Gastroenterology. Cerner GI is a tool that provides templates for your gastroenterological procedures, as well as linking to those cameras and towers to make sure those images are coming directly into the vendor neutral archive and can be incorporated into the reports that are being generated inside of PowerChart. Health information management. HIM is a key and integral part of management of any health system, and we have a full set of tools that are integrated as part of the Millennium platform. That includes document integrity, coder groupers, release of information, and then management of consents even. So we have included patient mobile e-signature, so the capability to capture on a tablet or a pen pad the signature of a veteran related to consents or other documentation they may need to have signed. The process by which you manage queries as well as connections to the physician documentation, whole set of tools included from a health information management perspective. Interfaces. In any implementation that we've done in our long history at Cerner, there is the need for interfaces. So we are currently analyzing, cataloging, and understanding the interfaces that are needed. We're doing, as part of that analysis, we may want to make sure we understand if this is a system that it may be duplicative. And if it is duplicative, then we'll also make sure we understand the requirements required for that system and make sure that we have that represented in the Cerner Millennium solution. Interoperability. One of the most exciting parts of our work with the VA and the DoD is really the move towards potentially national interoperability. VA has done a lot of work and with the DoD and JLV as well as eHealth Exchange to further the cause of healthcare information exchange. As part of the contract with Cerner, Cerner is a founding member of Commonwealth. That is one of the national networks that can be linked together to facilitate health information exchange for the veteran. Using those two networks, the capability exists to link a lot of different parts of America and make sure that wherever the veteran is being seen, the information is liquid and can be seen in the community and vice versa. As part of that health information exchange in the short term, JLV is already embedded as another tab in PowerChart to view that information. So as the VA and the DoD have innovated to create JLV and share that information across the organizations, that capability exists today in the DoD environment and will be continuing to be there. But as we improve and use other tools to get more health information exchange happening, those will be there as well. Millennium is a FHIR-capable system. So we have included the Ignite APIs for FHIR. That's Cerner's toolkit to connect and Smart on FHIR applications, either into Healthy Intent or Millennium. So as the industry moves towards EHRs becoming more of a platform, we are facilitating those connections using those Ignite APIs. We have committed to full documentation as well as submission to immunization registries across the nation. You see a couple items here, OpenEngine and OpenLink. Those are some of the Cerner interface tools that will be brought to bear in addition to other commercially available interface tools. Cerner Direct is part of the Direct network where you, right from PowerChart inside of the Cerner Physician Workflow and Message Center, they'll be able to do direct messages to other providers that have direct-enabled EMRs. Another simple example of how we can improve interoperability using a toolbox of things that are available in the Cerner contract. This next bucket is interesting because it has a lot of different things in it. Inside of Cerner Millennium, there's a lot of configuration. And then there's a lot of standard stuff. But then there's also a lot of configurability using some of these knowledge solutions that I'm going to discuss briefly. First and foremost is Cerner medical terminology. All of your standard terminologies, SNOMED, LOINC, ICD-10, etc., are all part of the Cerner medical terminology library that's inside of Millennium, and as well as Healthy Intent. Those terminologies help to drive codification of various medical terms and then cross-linking as well. We'll be able to use the Discern Rules Engine, which is represented in here at the bottom, the Decision Support Engine. As part of the configuration is a set of tools that allow for the VA and other clients to go ahead and create custom rules, notifications, as well as non-interruptive decision support tools inside of the Cerner Millennium or Healthy Intent platforms. A couple other things that I'm going to highlight here is Advance and Lights On. Advance and Lights On is run off of timers in the Millennium solutions to elucidate not only how the system is performing, but then how are the end users performing when they're using the solution? How much documentation are they doing? What is their CPOE percentage? How much time do they spend reviewing the chart? How much time do they spend in the chart overall per patient? So we can use these markers to actually target training and improvement to the solutions as well. With that, As we look to do deployments, we'll be monitoring these tools very closely to make sure we're getting good, effective use of the Cerner Millennium Suite and ensuring clinicians are having the best end-user experience, or at least part of that end-user experience. We will have a number of things around biosurveillance, catheter-related infections, decision support, as well as integration into the infection control solution I mentioned earlier. Patient education is fully embedded within Millennium. As you discharge a patient or finish a visit with them, you'll be able to access that information. In fact, the system will offer suggestions based on the patient's diagnoses, what patient education you may want to provide to them. That'll be integrated into their workflow, and then you can actually provide that to them, like I said before, in the portal or via paper. A couple of nice additional tools that are newer are rapid response and support, sepsis management. As part of the decision support tools within Cerner, we have programs that help to facilitate and ease the usage facilitate the coordination of a rapid response team and or direct and recommend care related to sepsis management. The sepsis management tool is something that's deployed nationally. We are using machine learning as well as predictive algorithms to improve that sepsis algorithm on a continuous basis. We've done somewhere between 15 and 20 iterations on that out based on real-world experience, and it is monitoring several million patients a day. As we turn the page, let's focus on one of my favorite areas, laboratory. I didn't mention I'm a pathologist, and transfusion medicine is my subspecialty, so this is near and dear to my heart. You'll get the full Cerner suite of PathNet solutions. Again, fully integrated solution that is running on the same Millennium database. Included in that are your general laboratory, as well as microbiology, transfusion, HLA, genomics and Helix, as well as anatomic pathology. All of these solutions, Cerner started as a laboratory company, so Cerner has been doing this for close to 40 years. The PathNet solutions are actually already running inside of VAMC today. So we will continue to do that rollout, and it will facilitate all aspects of the laboratory operations. One thing that I would highlight here is, and we'll talk a little bit about in point of care and mobility, is the ability to do positive patient ID for specimen collection, as well as transfusion at the bedside. So all integrated into Millennium, PathNet, as well as front-end acute care delivery, as well as other solutions to facilitate getting the right laboratory result to the right patient. PowerChart Oncology is a suite of solutions that facilitate the care of patients in the oncological space. Chemotherapy regimens will be built, and there are specific functionality and workflows related to the intricacies associated with chemotherapy administration. One of the aspects I'll refer to now is also, from an oncology perspective, your bone marrow transplant. We have brought Otter as a partner to facilitate the bone marrow transplantation cellular therapies as part of the program as well. PowerChart Oncology is not only front-end oncological workflows, there are pharmacy implications as well, double verification of chemotherapeutic agents as well. We're currently in the process of fully looking at VA's patient accounting operations. We've started to have discussions and are working closely with the organizations such as CPAC, as well as local organizations that are taking care of the patient accounting and the intricacies associated with the veterans and potential payment for their care. VA does a fair amount of care that is compensated, and so we want to make sure that those operations are working smoothly. One thing that's not intuitive in this description is also how are we going to do cost accounting, workload management, etc. As part of those conversations with the patient accounting teams is making sure we're managing and identifying workload and assigning those properly, as well as giving cost accounting information so that budgets can be maintained, all as a result of clinical care and clinical documentation. In the perioperative space, again, a full suite of solutions. The tool is actually called SurgiNet. Again, a clone to PowerChart. The look and the feel inside of SurgiNet is very similar to the rest of the chart anywhere across the organization, where they start as a tracking board. Tracking board for the surgical areas can be posted in secure areas as well as patient-facing areas to provide updates directly from the documentation intraoperatively to the patients to the patient's family if they're waiting in the waiting room as well. Embedded inside of SurgiNet is AORN integrity content. The Association of Operative Room Nurses has a standard set of data that defines and helps standardize how we collect and benchmark data related to the operations. The solution, one thing I didn't mention, is this is, of course, for preoperative, intraoperative, as well as postoperative. Because it is a single integrated database, when that patient, if they're starting on the floor, go to the operating room, then return to the floor med surg unit, That's a single record. And data from the intraoperative space is available to the postoperative care team in the PACU as well as on the floor. If you're doing ambulatory surgical cases, same sort of thing. The visit from the surgeon in the clinic is available in the single location where they're going to be doing the documentation related to the operation as well. Surgeons actually use PowerChart, not SurgeonNet. The tools they need and the orders that they issue are just seen inside of SurgeonNet to those folks that have the SurgeonNet workflows. An important piece of this, obviously, is anesthesia. Cerner's anesthesia module for intraoperative documentation is included in your solution. It's a touch-enabled solution that is purpose-built for anesthesiologists and the documentation that they need to perform related to medications, fluids, estimated blood loss, etc. One of the nice features of this is that there are elements that are shared between surgical nursing as well as anesthesia. The VA will decide, say, who is responsible for surgical start time. And that information, based on who is documenting that, will be shared to the other person. So one person has to document it, but both people see it and can agree upon the times as well. Inside of the anesthesia solution is your full integration using your CareAware platform to your gas machines as well as your intraoperative monitors. The documentation, as soon as it's signed from an anesthesia perspective, is available in PowerChart to everybody to review. And in fact, the medications go directly to the patient's MAR, so you have complete visibility to the medications that were provided intraoperatively. No longer, even in the days prior to electronization of medical records, no longer is that anesthesia record and or things that happen in the operating room kind of a black hole. It's fully visible inside the workflow of any care provider that needs to look at it. We're bringing a partner to facilitate tissue and implant management, which includes your reporting, lot and serial number tracking, and then even eventually, if need be, recalls, etc. That information is shared inside the Millennium Suite and brought to the patient bedside, so those can also be tracked as needed. Pharmacy, very large effort here in the pharmacy space. We've started to engage with the subject matter experts from the pharmacy at the VA, and to fully understand CMOP operations, we will be doing interfaces to make sure the CMOP continues to deliver the high volume of medications that are being run through it. The order starts, of course, with a physician or a care provider that will be then routed to PharmNet. PharmNet is embedded in PowerChart, so again, single integrated database that allows for complete visibility to the entire care process to the folks based on their role. That medication management dispensation of the ambulatory e-prescribed medications, as well as on the inpatient side, doing verification and dispensation of medications to acute care locations. Included in that is the Multum drug database. Many of you may be familiar with the First Databank solution used today. Cerner employs Multum and will be making a transition there. We do have the capability to do e-prescribing to outside pharmacies if need be, or the veterans care as well, using SureScripts. We've committed to embedding the prescription drug monitoring programs from every state in the union. We actually have a partnership with a company called Appriss. Appriss actually manages the PDMPs for a large proportion of the states and has a proprietary tool which is embedded into the workflow of a clinician, which allows for as I've heard them describe it, a credit score for narcotic sedative usage. It's an indicator, proprietary indicator, that there may be potential for abuse, and then allows for full access to the PDMP prescribing information, prescribers, as well as frequency of prescriptions. In those states where they don't use the Appriss solutions, we will be embedding those PDMPs inside PowerChart, saving clinicians clicks to make sure that requirement to check the PDMPs is integrated. We are working on a white paper to fully elucidate how we would do opioid management across the VA, that being holistic of pain management, PDMPs, and then treatment for substance use disorder in the veteran population. So you can look forward to seeing that coming to you soon. Point of care and mobility. I've mentioned a number of these items already, specifically specimen collection, as well as bedside transfusion management, and then barcode administration. Solutions that are fully integrated into Millennium and allow for the positive patient identification in all of those high-risk areas. As you do barcode med administration, again, running from PowerChart, you're able to scan the patient, the med, and ensure that the patient is getting the right med at the right time. A couple areas that are being investigated for full deployment based on cybersecurity and device requirements are CareAware Connect and PowerChart Touch. CareAware Connect is a messaging tool that can be done on iOS devices and Android devices that allows for secure texting within the care team. There's actually tools from a nursing perspective that allow for identification of who's on, care team members, etc. PowerChart Touch actually is a suite of tools that includes 4 things: Touch, Camera Capture, InstaNote, and Mobile Message Center. So camera capture, very intuitive sounding. You're able to use your phone's camera, capture an image. Nothing is stored on the device. It's automatically uploaded into Millennium, so you can actually include that from a wound imaging perspective, surgical case perspective. Very important, easy to use tool. PowerChart Touch is a full workflow for documentation and review of the patient's chart and even ordering of selective things. The Mobile Message Center, I've alluded to Message Center as a communication tool inside of Millennium that allows for, particularly in the ambulatory space, for communication and coordination of care of veterans. And then finally, the secure texting pieces are available as well. Those things are dependent a little bit on some work that needs to be done related to cybersecurity and device integration and approval. We're working diligently with the VA to understand those requirements and making sure we meet the needs as specified. Next, we're going to talk about population health and analytics. I talked early on extensively about Healthy Intent. Healthy Intent is when we do our data migration, and John will have done some discussion around our data migration efforts. Healthy Intent will be the front door to that data migration. What we'll do then is actually recreate a longitudinal health record. That longitudinal health record from whichever sources are input into Healthy Intent will be displayed inside of Millennium. So like JLV does today, the Healthy Record will be able to reconstruct a patient's longitudinal record across time as well as locations. Secondary uses of that are your analytics and then as well as your care management elements. Care management specifically around registries and creating how do I manage populations using registries. The registries are a little bit different than what my experience has been to date in how the VA thinks about registries. Registries are more of a tool to say, okay, I have this list of patients for my clinic and I have to do these sorts of things. And how am I doing against those metrics we want to establish for diabetics, say around foot examinations or blood pressure management or hemoglobin A1C. It takes all the information from Millennium, collates that, and provides a score as well as tracking and the ability to go ahead and manage all of those aspects of that particular condition. Health eCare is an extension of those registries and actually provides workflow for outpatient case managers to be able to review a panel of veterans they may be responsible for, making sure they have high touch and making sure they stay healthy and mitigate any possibilities of a readmission as well. Longer term, the 2 solutions that are on here are Healthy Data Lab and Healthy EDW. I mentioned at the core, Healthy Intent is an analytics engine, and Healthy EDW or Enterprise Data Warehouse is that component. As we work with the VA to understand their current reporting and analytics needs, there will be a strategy by which we migrate some of the things you do in CDW or other locations to Healthy EDW. As we do that, we will make sure that, and we're already working in the short term to understand the reporting needs of the VA at the end user level, at the department level, at the institution level, and then at the enterprise level. As we define those, we'll bring to bear other Cerner solutions related to reporting, not just the Healthy EDW. And in the short term, some of those things may exist as they do today, and that'll be on a case-by-case basis. Healthy Data Lab is a future-looking solution that allows for researchers and other folks that are doing operational management to create unique data lakes of information to go ahead and run tools such as predictive analytics tools, machine learning algorithms, to develop new knowledge related to the data that's in Healthy Intent. That also is something that's forward-looking and in the short term may not be something that's deployed quickly, but there is the capability for the VA to start thinking about what that looks like and how we're going to utilize that. Very important, obviously, to the VA mission is research, and we are working diligently to understand the current research needs, where the reporting is happening, how those processes occur, and make sure there is no break in the current research capabilities of the VA as we go from locality to locality. Quality and performance improvement. Many of the knowledge solutions I discussed earlier are similar. We provide full reporting to regulatory bodies, including JCAHO and others if they're applicable. Inside there is a set of quality tools that allow for new quality initiatives as well as established ones that are in the commercial space. Similar to research, we're working diligently to understand and make sure we catalog fully all of the quality initiatives, including sale metrics and other things, inside the VA, and we're going to be replicating those and or facilitating the reporting of those things from the Millennium and Healthy Intent platforms over time. Radiology. RadNet is the solution, much like we've talked about with FirstNet, SurgeonNet, PathNet, RadNet. RadNet is your radiology information system. We currently plan to keep local PACSs in place. We will be doing an archiving of those PACSs to the vendor-neutral archive for longer-term storage as well as distribution across the enterprise. But the local PACS, at this point, there is no plan to change those going forward. The radiology information system obviously helps to manage the scheduling, the manipulation of the modalities, and the capture of the images that are required based on the orders coming out of PowerChart. One thing we'll be adding is the ACR Select tool. ACR is the American College of Radiologists, and they have provided direction and appropriate use criteria, which will become a regulatory requirement in the future related to outpatient ordering of radiology images. It's a very nice tool that allows, as you order, alternates to the test based on the condition of the patient and the things that are already documented in the chart. So for low back pain, it may recommend a different imaging modality based on the information in the chart, and it allows very quickly for the end user to change their selection and go with perhaps what's recommended as a more appropriate radiology imaging modality. Importantly, mammography management is part of the RadNet system. As the veteran population expands, we want to make sure that we're taking care of the needs of those female veterans and other people that need mammography services inside of the Millennium tool set. I've already discussed briefly some research when we talk about analytics. Other tools that will be brought to bear include HealthFax and PowerTrials. PowerTrials is actually a tool for the clinical researcher as well as the end user to screen populations for clinical research. There are tools in there to manage the protocol, the criteria for admission into a protocol, and then again, an end user can say, are there any trials that my particular patient may be eligible, and allow them to screen against all the protocols that are available. Great tool to help manage some of the intake as well as basic management of your clinical research. HealthFax is a database that's de-identified that clients agree to submit their information to. As a result of agreeing to submit information to it, they also can pull from it. So at this point, we will allow the VA to go in as we submit information to use that same de-identified database that is not just the veteran population, but the commercial population of over 70 academic medical centers, contributing information into that space so that new knowledge can be discovered using those tools. Supply chain. Very important from an inventory management perspective. Everything from how does an order and something that's used in the surgical space get replenished and resupplied to the VA. That supply chain is part of the toolkit we'll be providing. There are intricacies, obviously, around durable medical equipment as well as true prosthetics and things that are considered in the prosthetics package today in the VA. Those things are being considered as well to make sure that we don't have loss of inventory management as we transition to a Millennium environment. Support services. Very important from a technical perspective. First and foremost, the VA's system will be hosted in Kansas City in the Cerner data centers. That is a secure environment that currently holds, based on how you count it, somewhere around 25% of the health information in the United States today. So those data centers are managed to the highest level. World-class facilities from a data storage infrastructure management perspective. Application management services. Cerner will be providing the services around upkeep, configuration of the Cerner solutions as well. There will be some things that are designated to VA enterprise or VA localities, such as end-user management. Those sorts of things are normal parts of large implementations that we perform, but there will be a process by which enhancements or requests for enhancements can be funneled into the application management services, and then an adjudication process with the VA to determine what's appropriate, what's a great idea, what's not capable today, and then we'll be able to manage the environment. Since it is a single environment across the nation, that change control there that is associated with management services is vitally important. Some system tools. First and foremost, we'll talk about 724 Access. In the unlikely event that the system is down, 724 provides a downtime viewer for patients that are in the acute care space as well as other venues. That is updated every 15 minutes. So you do have a up-to-date snapshot of the patients you're caring for in computers that can provide that information without any internet connectivity. P2 Sentinel is actually Cerner's tools for auditing of access of the solutions and will be available and help from a policy perspective in maintaining the confidentiality and the security of veterans' records. Instant Access is your single sign-on tools. Those will be made available to the VA as well. Some of the things around point-of-care mobility are medical device management is what Skybox Mobility is, a tool that helps clients manage those end-user devices as well. The next bucket of things is transaction services. Patient accounting and health information management registration is very complicated, and there are a number of tools in the environments in the commercial space that have applicability to the VA, particularly related to automated messaging, claims management, even providing patient letters, and then contract management as well. So those are our tools that are available to the VA to integrate into patient accounting, HIM, as well as registration processes. Getting close to the end here, so last couple boxes. The next one is transplant. I mentioned previously bringing the partner Otter to the table. They'll be bringing two components. One that I've alluded to previously is the cellular therapies related to bone marrow transplantation and oncology. And the second is solid organ transplantation tools, including UNOS data connections. So those two tools will help in those centers of excellence that provide cellular as well as solid organ transplantation. Women's health, a burgeoning population inside the veteran population. We are providing PowerChart maternity, acute, and ambulatory. It's our understanding today that the VA does not deliver babies, but we do have the ability to facilitate the care of those patients that have maternity needs in the VA. More often than not, what we've been communicated is in the first 3 months, the VA will then help manage that or identify that, and then we can take that particular patient out to the community to manage the remainder of their pregnancy. An important tool, and as the VA thinks about expanding its scope of services, it is available for the VA if the VA so chooses to do those sorts of things. The last category we're going to talk about, workforce and operations. Very important to do close management with data of the workforce, making sure the workforce is adequate from a staffing as well as workload perspective. So we're going to bring a number of tools in this area. First and foremost is capacity management. Capacity management is actually how do I manage the patient flow through an organization? So this provides tools to transporters as well as housekeeping and bed managements to understand and make sure turnover of beds is coordinated with the electronic data from a discharge perspective or an admission perspective. That bed management solution is holistic and allows for closer management of those beds in a single place integrated in the Cerner Solutions set. Demand management and patient-driven acuity. We have a solution called ClareVia. ClareVia is a acuity-driven nursing staffing solution. It actually helps, based on the patient's acuity, staff appropriately from a nursing perspective, and also provides algorithms, much like Apache does for a medical surgical unit. Well, Apache for ICU, my correction, and a ClareVia for a medical surgical unit. Predictions of possible patient needs from a care perspective and what the appropriate staffing is. That also can actually help predict, based on time of year and other elements, what the potential could be for staffing needs. And finally, workforce management. Again, an offshoot of that is the ability to go ahead and staff and manage the scheduling of nurses and other care providers inside of the VA. So, got a lot of information. I hope it was helpful to you. And this is the tip of the iceberg. There's a lot of functionality and solutions that are embedded in the broad categories of things I've described to you today. Lots of detail, and I know many of you have lots of questions about the solutions used today. Will they be replaced? Will they remain? Do we have these particular data elements, etc.? In closing, I will say Millennium and Healthy Intent are very configurable solutions. A single data element can be configured into Millennium with minimal trouble. The harder aspect of that, of course, is then to workflow integrate, make sure we're capturing, and then what's the link from a data management perspective to how do we report and understand the use of that data elements. We're doing all of that work with the VA. We thank the VA for their cooperation and collaboration in making sure we understand the unique needs of the VA and how these solutions can help facilitate the care of the veteran. Thank you again. Appreciate your time and hope to meet some of you soon.